Andrea, and I'm so excited to be here on my couch in my living room with Paige Bellenbaum from the Motherhood Center. Welcome.
Thanks for having me.
You're welcome. I'm so glad you're here.
You too.
She literally just like came in the door and we sat down to talk. So here we are. I would love to start having you tell us a little bit about yourself. Tell me what you do, who you are, introduce yourself to the audience. We have a ton of people who said they want to come.
Oh, good.
Yeah, and I'm so excited. This is something I've really wanted to do for a very long time, so this is great. This is such an important conversation to have.
Well, I'm really honored to be here and very excited. And so a little bit about me and who I am and what I do. I'll start with, I'm a mom. I have a 12-year-old son and a 10-year-old daughter. And I came to the field of perinatal mood and anxiety disorders because when I had my son 12 years ago, I myself experienced severe postpartum depression and anxiety. And this was 12 years ago, mind you, where there's nowhere near enough support for women who are experiencing depression and anxiety in the perinatal period now, but 12 years ago there was significantly less. So even as a trained social worker who was educated on recognizing mental health issues in other people, when it happened to me I had no idea what was happening. And it was the most debilitating, crippling experience I've ever had at a time where we feel like we're supposed to enjoy and love becoming a mother and that transition. I did not seek help for many months. I was so guilty and ashamed. I was worried about being judged. I just felt that I was a terrible person and mother because I wasn't connecting with my son the way I felt like I needed to or I should. And for me personally, there was one particular day where I was walking my son in a stroller and a bus was passing by and I saw it coming, and the closer it got, the more of an urge I felt to throw both of us in front of the bus. And it was all I could do to hold back, and I remember as the bus passed by I caught a glimpse of my face in the reflection of the window, and the person I saw was somebody that I just didn't recognize.
Oh my God.
And I knew in that moment I needed help. So I threw myself and my son in a cab. I went to the only place that I knew that existed that provided treatment for perinatal mood and anxiety disorders. Interestingly enough, when I got there, it was the Payne Whitney Women's Clinic at Cornell Hospital. Fun fact is that somebody who was on my evaluation team is now my partner.
Oh, wow.
My partner that I opened the Motherhood Center with. So I got help, I got treatment, I went into therapy, I went on medication, I got better. I got mad because nobody ever said to me then, and oftentimes nobody says to moms now, PMADs are a very real thing. Look out for them. They're common, they're treatable, this is what they look like.
The most common complication.
Most common complication in childbirth. The most common. So I went on a mission more on a legislative angle to write public policy around screening and treatment. And then I, for many years, kept close to this area, but it wasn't until about 2015 when I joined forces again with one of my treaters, Dr. Catherine Berndorf, and we decided that New York City needed a motherhood center. And so what I am so lucky and happy to do now is provide clinical treatment to new and expecting moms that are suffering from perinatal mood and anxiety disorders at the Motherhood Center.
That's amazing. How I didn't know that you did legislative work before that. Is there legislation around reporting and?
There is. So happy to say that more and more states and localities are embracing public policy and legislation around screening, treatment, education. So back in 2014, which is when the law that I drafted was finally signed into law in New York State, it was severely watered down because, as we all know, women are still fighting for relevance in society and prevalence. But it did strongly encourage screening, and it it required every hospital across New York State to provide women with information on PMADs. What are the baby blues? What's postpartum depression and anxiety? So yeah, there's a lot of states and cities that have some kind of policy on the books, but again, as I'll say throughout tonight, we're nowhere near where we need to be.
No, it's not enough.
Yeah.
Yeah. And if postpartum depression, I know that men can have mental health issues in early parenthood for sure.
Right.
But if it were happening at the same rate, at the same prevalence with men, it would be a different
It'd be such
landscape.
a different story.
Yeah.
And you're right, to your point, men do experience them at lesser rates. But it's funny, at the Motherhood Center, we are all women, clinicians. We're not opposed to having men, it just so happens at the time we're all women. And every once in a while when this topic comes up of PMAD with partners, and I do take it seriously, it is a real thing. And then the other side of me says to myself, privately and also outspokenly, can't we just have one thing?
Yeah, can this just be ours?
Can't we just have perinatal mood and anxiety disorders, please?
I teach infant care and breastfeeding classes, and I do a whole spiel on PMADs, and I spend quite a bit of time on it.
Right.
I talk about the Motherhood Center, and I give people
Thank
all the
you.
resources, and I always look at the end and say, oh, and men can have them too. And it's like a 20-minute spiel, and then, oh, sorry, I meant to mention that earlier.
Right.
Can't we just have one thing? Just one. I have a million questions because I've had so many moms sit in this room with their babies and talk about, so many things. Talk about going to their 6-week checkup and saying, I'm crying all the time.
Right.
I'm crying every day. And having their care providers say, that's new motherhood.
Right.
Welcome.
Right.
What does a person do if they are worried about their own mental health and the people around them aren't listening?
Right. It's a problem, and screening is only just now and recently being strongly encouraged from higher ups. So ACOG, which is I'm not going to get the acronym right, but it's basically the pyramid that provides support and guidance to all OBGYNs across New York State and the United States. There's the American Association of Pediatrics, right? That both of these entities have recently come out with guidelines that strongly encourage and recommend screening of women, both in OBGYN practice and even in the pediatric setting.
Well, pediatricians are the ones seeing them.
Pediatricians are the ones that see women so frequently.
Yeah.
So having done a lot of kind of background work, meeting with both OBGYNs and pediatricians, things are changing, things are getting better, but historically there has been this concern and obstacle that both parties have felt. When we talk about OBGYNs, they oftentimes feel like, I'm not a trained mental health clinician.
Yeah.
I don't know how to determine whether or not a woman is suffering or struggling with a mental illness. I'm not sure what to prescribe, how to prescribe in the perinatal period. I don't feel safe, this feels risky. And pediatricians even more so, but the patient isn't the mom for me, it's the baby, right? Things are changing, again. We have a long way to go, but we're seeing more and more OBGYN practices, both private and public, and even pediatricians recognizing that this responsibility is on them. Now, not being screened for a new mom or even a pregnant mom is happening all the time. One of the beautiful things that we see at the Motherhood Center, one of the elements of care that we provide is our day program. So women come, we have an on-site nursery, both pregnant and postpartum. They spend 5 hours a day, 5 days a week with us. They have all kinds of support groups and individual therapy, medication management by reproductive psychiatrists. But one of the things that we always see when somebody graduates from the day program and they start feeling better is this, like myself, this kind of fury of like, I can't believe that nobody told me this was going to happen. I want to do something about this. And so often one of the first things we encourage these moms to do is go back to your OBGYN, go to your pediatrician and say, you missed this, right?
Oh, wow.
You missed this, and this is my story. I struggled, I suffered, and hey, OBGYN, hey, pediatrician, did you know that if PMADs go untreated for a long period of time, that it can have a negative impact on the development of a child? So it's in your best interest, OBGYN and pediatrician, to screen for this and make yourself available to and know about what kind of resources exist in your community. So if you do screen a mom and she does get a high score, regarding on what kind of screen you use, you can say, hey, PMADs are really common. Your screen is showing me that you're experiencing some PMAD symptoms. Let me give you this referral, right? It's that easy. It doesn't take a lot of time.
No. I think, well, yeah, the mom's not my patient is I know a common objection. But I think also there's an attitude of like, oh, sure, I'm going to hand them a list of names they're never going to call.
Right.
Yeah.
So I'll tell you something that we do at the Motherhood Center, and again, we're New York City based, but we've actually, because we wanted to solve for that, we have a certain referral system whereby if a pediatrician or OBGYN has this conversation with a mom, screens and says, look, this is your score, I really want to refer you to the Motherhood Center, knowing full well that by just giving a palm card or a phone number, a mom might not do it. We have a system worked out where a pediatrician can say, how do you feel about me letting the Motherhood Center know that we had this conversation and have them give you a call?
Oh, that's amazing.
Yeah, and that helps a lot.
That's
because
amazing.
Then we can call mom and say, I spoke with your doctor. Let's talk about what's going on.
Oh, that's amazing. Wow. And do you have a lot of pediatricians who are doing that? And
pediatricians, some, more OBGYNs. It is I think it's a slower flow to get pediatricians to buy into this, and I get it, and they need to do it. But yeah, it's been very successful with OBGYNs.
Courtney McKee, thank you for your question. She asked, why don't OBGYN clinics hire social workers and mental health professionals?
Courtney,
what?
This is the wave of the future. This is what we want to do.
Yeah.
We want to make sure that OBGYN practices have a trained therapist, psychotherapist, clinician on site who can do the screens, who can do short-term therapy, can do an evaluation, can really figure out the acuity of a mom's symptoms, and provide for her an adequate level of care. This is what I'm hoping the wave of the future is. So Courtney, we are on the same page.
That would just be so amazing. Especially because then you catch women when they're pregnant.
Yep.
So many moms are suffering in pregnancy, and nobody's talking about that. There's even more shame there, I think.
Nobody talks about it, and the truth is that 50% of all perinatal mood and anxiety disorders develop during pregnancy, and we're not talking about it.
No, because you're supposed to be happy.
Yeah.
And so another thing that comes up often in the group is people who feel like, I'm just tired. I'm exhausted, and as soon as I get a little sleep,
I'll feel better.
I'm gonna feel better. I'm just tired.
Right.
This is just, of course, mothers who are sort of not honoring the depth of their own symptoms. How can a person, how do you tell the difference between depression and exhaustion?
This is the number one question is what is the range of normal, and where does it hit the level of crossing over normal or the barrier to needing a little bit of extra care and support and treatment. So as everybody or most people know, that there is this oftentimes 2-week or less period called the baby blues. 80% of all new mothers experience it. It is lack of sleep, it is a surge of hormones, it's being weepy in and out of the day, it's feeling irritable, it's feeling overwhelmed, right? These are very, very common phenomenons for a new mother to experience. I quite frankly have never ever met a mother who hasn't. It's probably more like 100% of women who experience this, but as clinicians, if somebody's symptoms are continuing on past the 2-week mark, and if a woman is feeling progressively more weepy, overwhelmed, anxious, hopeless, helpless. You know, one of the things, because it's really, it's hard to explain exactly when somebody needs a higher level of care. What we typically use as a guidepost is the level of distress, right? Like, what level of distress is a new mom experiencing? Is this distress, whether it's anxiety, depression, OCD, whatever the symptoms might be, is this really interfering with her ability to care for herself or the baby, right? So if a mom is, not able to sleep when the baby sleeps, this is like one of our number one questions. Are you able to sleep when the baby sleeps? Are you eating? Like, these are, if a mom says, no, I can't sleep, I can fall asleep but I wake up, but I can't fall back asleep, or I can't fall asleep, or no, I haven't been eating anything, then that's typically a red flag for us that something's going on, right? Yeah. So if these symptoms and feelings are causing a great level of distress for an extended period of time, whether it's perhaps, like normal mom anxiety or not, it's always in the best interest of the mom just to find out, just to ask questions, just to reach out to resources to make sure. Because I think so often, just because of society and because we're women, we are genetically and societally, molded to just push forward, persevere, pull yourself up by your bootstraps. I'm fine. I don't need to ask for help. Yeah. I've got this. But there does come a point where it is, if you're crying all day, if you're having over and over again what we call scary and intrusive thoughts of harm coming to the baby, if you're having obsessive thoughts, if you feel like you can't turn off your mind and it just keeps, it's like a hamster wheel going over and over again, or if you're thinking about, I don't really want to be here anymore, or I don't feel connected to my baby and I just want to leave. These are things to explore.
I had this one mom coming to mind who sat right there in that chair and said, my baby deserves better. My baby deserves a better mother. I shouldn't have done this.
Yep.
And what was crazy about that group was that other people in the room saw it and then said, oh, I've had that thought. Oh my God. We all saw that was a clinical level that needed treatment, but everyone in the room went, oh God, am I okay?
Right.
Yeah, it's a scary place to be.
It is a scary place to be. And I like to tell moms that come to the Motherhood Center, when I was at my worst with my son after he was born, I will never forget one day, I don't think I'd been out in weeks, and I dragged myself out to the park, and I had him in a sling because it's the only way he would sleep. So not only did I feel like my life had been completely taken away from me because he was born, but I had no physical separation, right? Like, I was nursing, he wouldn't take a bottle, he could only sleep on my body. I felt so physically and emotionally trapped. So I was sitting there at the park. Maybe I'd taken a shower in the last week, I'm not sure, but I certainly was wearing the same outfit that I'd had on for quite some time. And I was just sitting there, and this beautiful woman came walking towards me with this gorgeous baby, this girl. She had rosy cheeks, fat cheeks. They were smiling at each other. Mom had her makeup on, her hair done. She was like that size 2 mom that like gained only 3 pounds in her pregnancy. And she sat down next to me and she looked at me and she said, isn't this the greatest thing that ever happened to you? And I looked at her and I said, no. This is like the hardest thing I've ever done. Most of the time I wish I never did it. And she locked eyes with me and her smile started to fade. And the tears started to roll down her cheeks. God. And she said, thank you so much for saying that. I feel the same way.
Oh, I'm getting the chills.
So we need to give each other permission to have these feelings because they're not wrong.
And they're more common than not.
They're so common.
Yeah. Someone said here, I've only experienced the screens as a 1-page, maybe 5-question thing. And my depression and anxiety were mostly overlooked because I gamed the questionnaire out of embarrassment for having these symptoms. And actually, and then someone else said I felt a strong urge to lie to my OB. Yeah.
Yeah.
I actually felt that
Yeah.
for sure.
Absolutely.
I wanted, like, no, I'm fine. It's that I'm fine.
Right.
I'm fine. No, that's
Right.
ridiculous. So the screening has always felt weak to me.
The screening is weak. I agree 100%. It's, unfortunately or unfortunately in science, like we like to have instruments that we can use to determine screens, and perhaps rightly so. Well, I know rightly so in the sense that many new and expecting moms feel this enormous level of guilt and shame about coming forth with and sharing and being honest about their feelings of anxiety and or depression, or the thought of harming themselves or somebody else, or all of these different questions that come up on these screens. They're afraid. They're afraid, if I let my doctor know that I'm having intrusive thoughts, if I'm having suicidal ideation, if I'm having any of these symptoms, that I'll be judged, and in the worst case scenario, my baby will be taken away. And thank God, there has never been an instance in New York City where this has happened, and most of the world, however,
I'm knocking on wood.
Not too long ago, it did happen
yeah.
in California. It's happened before, and so there's reason for that fear. So, interestingly enough, I had a woman who had just had a baby. She took a screen at the hospital upon discharge. She answered it truthfully, and she was feeling very depressed and anxious. The nurse took the screen and said, "Oh, honey, I'm going to ask you to do this again, because if I actually turn this in, you're not going to be able to leave with the baby." So there's reason to question the screen. At the same time, it's what we have, right? And then also at the same time, if you are in New York City, and even if you're not in New York City, there are places that you can reach out to that are trustworthy, that you can say, "Hey, I lied on my screen, but this is how I'm really feeling. Can I get some help?"
Do you have a resource for people who are not in New York City?
Yes. Postpartum Support International has been around since 1980.
Is that PSI?
PSI. So postpartum.net. www.postpartum.net. And they are the godmother of anything and everything PMAD related. They have just a wealth of resources. So they have a 1-800 number that you can call that's active 24 hours if you're in crisis or if you need any help. They have statewide coordinators. They have coordinators in every city, and their sole job is to help connect women in cities and states with resources that specialize in perinatal mood and anxiety disorders. They have dad support groups. They have online chat support groups. They have trainings. They have everything. So they cover the gamut of the U.S. So if you're not New York City based, they are grade A.
That's awesome. By the way, your story made everybody cry. There's like a whole bunch of people going, crying, me too, oh my God, tears. Which is, it's cathartic. Somebody asked, what's the best way to support a friend who doesn't want to get help but clearly needs it? That's tricky.
It's tricky. So I do a lot of trainings with doulas and postpartum doulas. I just did one on Saturday afternoon with about 25 postpartum doulas. And the same question came up. What do I do if I see something or I notice something in a woman that I'm helping, and I bring it up and I mention it and she just doesn't want help? The hard thing about accepting help is that we can't force somebody to want it. We can do what we can to normalize the experience for them, let them know that this is super common. I don't know if I use the statistics, but 1 in 5 women in the perinatal period, so pregnancy or postpartum, suffer from a perinatal mood and anxiety disorder. For those of us who do this work, we know it's more like 1 in 3. We can normalize. We can, if we've experienced something similar or we know somebody else who've experienced something similar, we can share stories. We can let women know, you know what, the good thing about treatment and support for this is that the sooner you get it, the faster you're going to feel better. You can make a call with a new mom and say, look, I know this is hard for you. I get it. I really want to get you some support. Let's call the Motherhood Center together. Let's call PSI together. But if a mom is really, really resistant to help, we can't force anybody into treatment. All we can do is make ourselves available, make the information available, make the resources available, and hold that mom, right? Like let her have her anxiety, let her have her depression, be with her in those moments, and keep coming back to the possibility of getting treatment.
For how long are women at risk, technically?
It's a very good question. So we said earlier 50% of all PMADs develop during pregnancy.
I didn't know that.
Yep. The majority of women will develop, if they haven't already developed symptoms in the pregnancy period. We see a lot of women develop symptoms from day 1 to 3 months. We also see women develop PMAD symptoms at the 6-month mark, at the 10-month mark. We consider it to be from inception to 1 year postpartum, but we know that,
So
and we've treated
much
women
longer than that.
that have a 2-year-old and 3-year-old
Yeah.
who develop symptoms within the first year, but they never sought treatment,
Mhm.
and they're still battling and experiencing those symptoms. So it goes across the board, and even more interestingly, like we have treated women who have adopted children. We had a mom who had a 2.5-year-old that she'd adopted 6 months prior, who had acute depression and anxiety. So it does not discriminate, right? Like it can rear its head across the spectrum of perinatal.
Wow. I'm running a toddler moms of toddler group at the moment, and it's for sure still an issue.
Right.
These are moms with kids who are like 18 months to 3.5,
Totally.
and it's coming up. You guys, please dive in and ask questions if you have any. We were thinking like another little while. Is there anything you want to cover that people haven't asked?
I guess what I would want to talk about that I haven't spoken about, and it's very, very rare, is postpartum psychosis. And this is something that statistics suggest impacts 1 to 2 in every 1,000 births. What we're seeing at the Motherhood Center now is a much higher rate of postpartum psychosis. And
Really?
women who experience psychosis, this is a situation that requires immediate hospitalization and a 911 call, because it renders a woman unable to discern reality and what's going on.
Mhm.
And sadly, oftentimes when we hear about things in the news of fatal things happening to either a new mom or a baby, it's because postpartum psychosis is at play. But I do just want to put it out there, we're seeing it as a much more prevalent diagnosis than research suggests. And one of the things that we're finding as inpatient facilities across the city refer women to us is that they're misdiagnosing it. So moms are going into an inpatient facility and they're coming to us being diagnosed with major depressive disorder, which looks very different than psychosis. And psychosis includes women who are having delusions, hallucinations. We think of somebody like Andrea Yates and what a horrible outcome that was. But here was a mom who had psychosis who thought that the only way she could save her children was to do what she did. And I just put it out there, as tragic and horrific as it is, it does happen, and we're seeing it quite a bit. And so in the event that anybody who's watching comes across a mom who is hearing things, seeing things, you can tell postpartum psychosis just by looking at someone. There's this kind of glazed, disassociative effect where a mom will just be holding the baby staring into distance, or doesn't want to have anything to do with her baby. It's rare, but it's something to notice, and in the event that anybody ever does come across that, it is an emergency, and it does require immediate assistance. And people get better from it. Postpartum psychosis is also treatable, but it's something we need to act on quickly.
It's always been my understanding that PMADs, more so than other mental health disorders, respond well to treatment.
Absolutely.
Which is, I tell all my prenatal class students that
Right.
that's a hard conversation to have with people prenatally.
It is.
Because they are, well, they're coming to an infant care class. They
Right.
want to know how to put a diaper on
Right.
and how to swaddle a baby. And when this starts to come up, people feel a little like, ugh, the room gets very uncomfortable. But I don't know what my point is. It's a really important conversation to have, obviously.
Well, your point is a good one. Is that this? So I always like to encourage people who are in, the line of providing support around birth or preparing pregnant women for the baby that's to come. Always get ahead of it, right? And for anybody who's had a baby, I can certainly attest to the fact when I was pregnant, all of these things that you told me I should think about after the baby came or this and the other, all I could think about was getting through the delivery, like all that ever stuff. I was like, that's a breeze. That stuff is easy. I just need to get this thing out of me, and then it's all going to be fine. And we all know that that is so ridiculously misinformed. That said, it's always good to get ahead of it, right? And even if it goes in one ear and out the other, to be able to introduce women to the prospect of this being a very normal thing, right? It's like, look, women know that gestational diabetes are out there, or they get tested for it during pregnancy. Like, the more that we can say, did you know that PMADs are the #1 birth complication in America? That catches some attention, perhaps,
For sure. Yeah.
So if we can get ahead of it and just talk about it from the onset of pregnancy and hit it along the way, I want to believe that women are going to be a little bit more amenable to noticing if it happens, but not just women, partners too. They have to know.
They're on the front lines.
They are on the front lines.
Do you have partners call on their partner's behalf?
Frequently.
And how does that work? Because again, aren't you then dealing with someone who's not seeking treatment for themselves? So
yeah, I mean, it's their partner and they call. We always want to speak to mom, but we have a lot of partners that will make the call and say, this is what's going on, what do I do? And we will speak partner through it and then say, let's get mom on the phone. We provide a lot of care and support to partners at the Motherhood Center. For Women in the Day program, we basically require partners to come once a week for a family session. We also have a partner support group. And, women who are experiencing a PMAD are experiencing an enormous amount of distress, and their partners are also trying to make sense of and keep all of the pieces up in the air while mom is going through this. And 99% of the time they are happy to do so, and they also need to be held and listened to and given a safe space to talk about how confusing this is and how stressful this is for them.
Wow. Someone asked if you could speak about the specific treatments used at the Motherhood Center.
Yeah, so we have different levels of care. We have everything from a PMAD support group that meets on Thursdays at 10, and this is a chance, again, we're dealing with the stigma here, even though we've made a lot of progress, but a lot of women are a little bit wary of coming in, getting an evaluation. What does it mean? The support group is a really safe, confidential space for women to come in, be around other new moms that are experiencing a PMAD, and see the facility. We are not a hospital. We have a license to provide medical treatment, but we are not affiliated with the hospital, particularly because we don't want to look and feel like a hospital. So if you've ever been to the Motherhood Center, if you ever come, it's a very
so
warm, comforting, it's like being in a living room. And we did that on purpose. So we have anything from a support group or classes in education around anything that's birth or postpartum related. And then if you take it up a notch clinically, we have individual therapy for women who are experiencing PMADs. We have reproductive psychiatrists that specialize in medication during pregnancy and postpartum. But then our real special level of care is our day program. And this doesn't exist anywhere in New York City, New York State, and only we're like maybe one of 6 nationwide that provide this day program where moms come 5 hours a day, 5 days a week, on-site nursery. Babies are required to come. Moms are in a cohort with like anywhere from 10 to 14 other women. They participate in all kinds of support groups and skills groups. So we know that with this particular population, different therapeutic modalities are very effective. So CBT, cognitive behavioral therapy, IPT, interpersonal therapy, DBT, dialectical behavioral therapy, women respond very well. So we include all of that. We also do expressive therapy, so we have mindfulness and meditation, art therapy, yoga, dyadic work, so we have therapists who specialize in the relationship between mom and baby. And all the while moms are with us anywhere from 4 to 6 weeks in the day program, they're followed by an individual therapist, a reproductive psychiatrist, and I gotta say, of the probably close to 175 women that we've treated so far in the day program, we've treated thousands in outpatient and support groups and others, but every single woman who has come through our doors has gotten better, faster. Every single one.
That's amazing. We had, I've had a couple of moms come to my groups who have been in the day treatment program, and they come almost like to do a PSA.
Right.
They come back and say like, you guys, someone mentioned it here, and that's how I heard about it. You need to know that this exists. And everyone in the room is like,
I want to go.
I want to go. It sounds amazing. I still want to go.
I know.
It sounds really amazing. There's a bunch of questions. Somebody asked if you're more likely, or if you are at risk with baby number 2 or number 3 if you had it with number 1.
Yes.
You are at a higher risk?
You're at a higher risk. So even before that question, women who have any kind of mental health history, anxiety, depression, anything prior to becoming pregnant or having a baby, we do know are at higher risk of developing a PMAD. And yes, women who had a PMAD with their first are at higher risk to develop a PMAD with their second or third. I do want to say though, having done it twice, and my daughter was a beautiful surprise, but dear God, when I found out I was pregnant, I was like, I cannot do this again. And I am one person, but I want to encourage everybody out there, if you've had a PMAD with your first child, and you have some perspective and you do some deep thinking about what are some of the things that might have contributed to your experience the first time, get in front of it, take ownership of it, create a treatment team for yourself in the event that it does happen. For me personally, I had mild symptoms. They were much milder than when I had my son. So that's just me. It's different for everybody. But I want to encourage you that if you did have it the first time and you're thinking about having a second or third, you are empowered to take control of your own situation and put in place supports and things that you need that are going to help it feel perhaps better or different the next time.
This is a long one.
Okay.
Someone said, thank you for your time and insight. This is Sarah Rebecca. I was wondering what your take was around previous experiences of trauma, depression, anxiety, prenatal, if it may predispose moms to PMADs. Since so many women have these experiences, is this a good indicator of people who need intervention? She's wondering why we discuss it only after birth, and why don't we spend more time discussing these risks earlier on in the process? Less of a question, more of a concern. Sorry, I didn't read the whole thing.
Right.
Yeah, that's right.
Yes.
How can we get to people earlier? I mean, having mental health providers in OB's offices would be a start.
That would be a start.
Yeah. I don't know. It's a really hard question.
It's a hard question, and it's getting better, right? So, you know, being able to, I do a lot of doula trainings,
Yeah.
right? So I have this special place in my heart for doulas and postpartum doulas because they're able to develop a more emotional relationship with a woman.
We have a ton of doulas in our group.
Love.
Yeah.
And I feel like they are the ones who can beautifully fill this void right now. Education, and please trust me when I say, having followed this issue for a very long time, we are making strides. We are totally on the uptick. We are moving in the right direction.
That's encouraging.
It is encouraging, and things are happening, and this is a very hot topic right now for good reason. And at the same time, we all need to be messengers, right? Like, we all need to talk to our OBs, talk to our peds, talk to our doulas, talk to anyone who will listen and say, this is important, and this is on all of us. This is on all of us to do the work and make sure that women know about this while they're pregnant, before they get pregnant, right? Like, in every OBGYN office where you see, what is gestational diabetes? What is this? There should be a what are PMADs, which we're working on right now. But we all also need to be the mouthpiece. And to the part of her question about trauma and everything else, yes, we do know that women who've experienced a lot of, or even a little bit of trauma, especially sexual trauma in their past, that they are at a greater risk. And for those of you out there that do have a history of trauma, that have a history of anxiety and or depression, doesn't mean for sure it's going to happen, but it does mean that there is a greater risk factor there. And if you are thinking about becoming pregnant, if you are pregnant and you are fearful that it might develop in the postpartum period, do the homework now. You can call the Motherhood Center. We can hook you up with a therapist, reproductive psychiatrist, have a treatment team in that's waiting, that's ready, so that in the event that you develop any symptoms, you know exactly what to do about it. Prevention, right? It's prevention.
Someone asked if the Motherhood Center takes insurances for different services.
So we work currently with all out-of-network insurances. I have to tell you that treatment for perinatal mood and anxiety disorders leaves insurance companies scratching their heads, right? Especially with a day program. So a day program usually exists for substance abuse or eating disorder. When we first opened our doors and we were calling health insurance companies for reimbursement for a perinatal day program, they were like, what is that? I don't get it. So we are moving in the direction of convincing insurance companies to be in network with us. We currently work with all insurances out of network. We slide. To give you an example, in the day program, we will spend hours on the phone with an insurance company to get them to reimburse at a reasonable rate, to make sure that that woman who needs that level of care gets treatment. We have done everything from providing scholarship care completely free of charge. We have charged women a minimal amount just to be there per day on top of whatever minimal amount her insurance carrier will provide. We will work with women to get them in, and in the not too distant future, the hope is that we will be in network, and also we're working on opening up a nonprofit which will then fully subsidize care for low-income women, women on Medicaid, to make sure that everybody gets the treatment they need. So we are committed and dedicated to getting to that place. We just need to bring the health insurance companies along with us.
That's amazing and exciting, because that always is the roadblock that I come across. If I refer people, they say, like, I know I can't afford it, it's never going to happen. Or they call their insurance company and say, I need a psychiatrist who treats perinatal mood issues, and again, the insurance company says, who does what? Here's a list of psychiatrists, none of whom actually provide, by the way. That's amazing. Wow, cool. You guys are doing a lot.
We're trying, and if we can get this right, and mind you, this has never been done before, so it's still a work in progress, but if we can get this right, I am here as your witness. Someday in the not too distant future, we will have motherhood centers scattered throughout the U.S. because come on, like,
why is it not
this
already?
Is a no-brainer.
Okay. Sorry, I'm just someone who has a generalized anxiety disorder. Long before she was pregnant, anxiety felt the same postpartum. Oh, that's an interesting question. How is it different?
Very good question.
I don't know that there was a huge adjustment. Not sure if it was a PMAT or just what she had before.
Well, this is a great question. So if you've had depression, anxiety, OCD, bipolar, anything in the past, you're at a greater risk to develop it in the perinatal period. And even though the symptoms might feel the same, it's still a PMAD because it's happening in the perinatal period. So it's happening during pregnancy or postpartum, which classifies it as a perinatal mood and anxiety disorder. I will say, and it's interesting to hear this perspective, that it feels the same. Depression and anxiety can look different in the perinatal period than it does prior in a more generalized way. So for example, depression in the perinatal period, specifically postpartum, there can be a lot more rage, fury, resentment, anger, which can look different in a generalized depression, where typically we think of people curled up in a ball with a blanket over their head, like not wanting to get up all day. Well, as a new mom, you don't really have that luxury, right? So the depression can manifest itself in different ways. And the anxiety can look a lot more, like I mentioned earlier, these like scary, intrusive thoughts where a mom will, out of nowhere, have this fear of, I've heard everything. I'm afraid I'm going to put my baby in the microwave. I'm afraid I'm going to throw my baby over the balcony. I'm afraid I'm going to drop my baby.
I was just going to say, the one I hear the most frequently is, what if I drop the baby?
Yes.
What if I drop the baby? What if I drop the baby? I mean, I had that thought for sure.
And that doesn't
what
mean
if my
that
arms
a mom
just stop working?
Yeah. That doesn't mean a mom has a PMAD. It is a scary, intrusive thought. And again, it gets back to the level of distress, right? Is this thought happening so frequently, so intensely, that a mom is just feeling so debilitated and distressed? Well, let's look at that, you know? If it's something that's happening like once a day and it's not making a mom feel that uncomfortable, then, you know, it is common to have scary, intrusive thoughts in the postpartum period. It's the intensity and the acuity at which we start to think maybe it might be something else.
That's so helpful, because I have a hard time defining what an intrusive thought is.
Yeah.
And that's really clear. I think we have addressed most questions. I'm having trouble scrolling down and seeing. I'm gonna click this because I might start the sound on the video. I just wanna make sure we got to questions. How common is it to have symptoms of PMADs beyond the first year? Do we have statistics on that?
We don't, because the Bible of mental health, which is called the DSM, the Diagnostic and Statistical Manual, only currently defines perinatal mood and anxiety disorders from conception to 1 year postpartum. And so because that is the Bible of mental health, there hasn't been a lot of research, or if any, really out there that determines whether or not, or what percentage of PMADs develop post 1 year. I would say 95% of the time, symptoms do develop either during pregnancy or within the first year postpartum. But that's not to say that it's impossible for them to develop after.
I spoke with a mom recently who's going back to work.
Yeah. Oh yeah.
After a year.
That is a trigger, an absolute trigger that can bring it on.
Yeah,
Yes.
for sure.
Yes.
You guys, are there any other questions before we wrap up? Great questions.
Really good.
Do you have any other things to add?
I just would encourage you, if you are in New York City, if you or someone you know are struggling, give us a call at the Motherhood Center. Yeah, and the way that we manage these kinds of calls is that women will call in, or their partners. We do a brief phone screen, so we try to get a sense of what the symptoms are, how long a mom has been experiencing them, or a pregnant woman. We'll get your health insurance information, we'll run it, and we'll try to get you in within the next 24 to 48 hours for an evaluation. And the evaluation will determine what the best course of treatment is for you. If it's therapy and medication, going to the day program, we'll get you the treatment you need to feel better.
Thank you so much. Really, one last quick question. Do you know of any free support group services in New York?
So PSI does some virtual free support groups. The support group that I run at the Motherhood Center for PMADs on Thursdays at 10 is $25. We do slide, so if somebody cannot afford that fee, we are happy to offer a discounted rate. There is a PMAD support group in Brooklyn If you look up Brooklyn postpartum depression, I think it's free. Other than that, I'm not aware of any other free PMAD support groups. But ladies, if there's somebody out there that wants to start one, give me a call and I'll help you set it up because we need them.
We need them.
We need them.
There are also more therapists in this area. I know we're on MOMally Parenting, so there are people all over here. But a lot of the moms who are commenting are local moms who are here in Astoria, and there are fortunately more people now treating people here.
The Root,
Kat Casey. Kat, are you here? I'm looking at the wrong screen.
Right.
Kat, you might be here. Yeah, therootTherapy.com, I believe, is her website. She's awesome.
Yeah.
And she was running a group.
Yes.
I don't know if she still is running a group, but Kat, comment here. I'm going to tag you in case you're not here. Yeah. Thank you so much.
Thank you.
Thank you guys for tuning in. And if you have questions, please ask them here, and I'll answer any. And are you in MOMally Parenting?
I joined.
You joined.
I did. And so if I ever see anybody posting anything about a PMAD or anything related, I insert myself. I hope that's okay.
Okay. And do you mind if I tag you in
Please
questions?
do. Please do.
Okay, great. Thank you so much, you guys. I keep thinking I'm going to turn it off from here, and I can't do that.
Thank you.
Bye.